Next speaker is Dilu Rupassara, and from Western and Central Melbourne Integrated Cancer Service, and will be speaking on a journey towards culturally safe cancer care.
Sorry, I'm just trying to see the notes, which I can't really see. But I'll use this, it's fine.
Okay. That's probably as good as it's going to be.
Okay, thanks. Thank you, Danny, for introduction. I am the Optimal Care Pathways Lead at the Western and Central Melbourne Integrated Cancer Service, or WICMIX as we like to call it. I'll be presenting the collaborative scoping project towards culturally safe cancer care on behalf of one of my colleagues at WICMIX, who isn't able to be here today. Before I begin the presentation, I would like to acknowledge the traditional owners of country throughout Australia and their continuing connection to land, sea and community. I pay my respects to them and their cultures, and to elders past, present and emerging. WICMIX is funded by the Victorian Department of Health and Human Services and was established in response to a statewide commitment to cancer reform. Our role is to work with hospitals to improve patient experiences and outcomes by connecting cancer care and driving best practice. Australia's record of cancer survival is one of the best in the world. Yet, Aboriginal people continue to experience disparities in cancer outcomes. Cancer is the second most common cause of death for Aboriginal people. Unfortunately, improvements in cancer survival rates have not been made to the same extent for Aboriginal and Torres Strait Islander people. Literature also tells us that poor communication from health providers and lack of Aboriginal staff at health services exacerbates the problem. To resolve this, health services need to commit to developing respectful partnerships with local Aboriginal communities and increase the capacity of services to be more responsive to Aboriginal people. Aboriginal people can face many challenges when accessing health services. These include unwelcoming hospital settings, lack of transport, mistrust of mainstream healthcare, a sense of alienation, and inflexible treatment options. This has resulted in an overall reluctance to attend services. According to the 2014 to 2017 Victorian admitted episode data, approximately 1% of the admitted population each year at the collaborating health services on this project is confirmed as Aboriginal and Torres Strait Islander. However, it is known that there is a possibility of underreporting of identification due to various reasons that this project has managed to unpack. The reasons for underreporting was already known and are well documented in literature. WICMIX undertook the project in determining culturally safe and respectful care for Aboriginal people affected by cancer with 3 large metropolitan Melbourne health services responsible for delivering cancer services. The first, a leading specialist hospital for the health and well-being of women and newborns. The second, a major tertiary hospital providing general specialist complex care, acute and subacute services, and a designated statewide provider for services including trauma. And the third, a leading cancer research, education and treatment centre dedicated for caring for people affected by cancer. These health services are committed to providing care and information to Aboriginal people affected by cancer that is culturally safe and accessible. The 3 hospital partners came together under the auspice of these three collaborative goals and connected with WICMIX to undertake the preliminary scoping activities. The aim of the project was to establish baseline cultural safety practices across the 3 partner hospitals. All health partners acknowledged this would be an iterative process, starting with understanding current practice. Amongst the project deliverables, literature-informed and evidence-based staged recommendations were wrapped into a final report. Project governance extended to a number of key stakeholders, with representation from 3 hospital partners and more broadly across the health sector. This proved to be a real strength, contributing to the success of delivering this scoping project, having the key decision makers engaged around the table right from the start. In addition to good project oversight by and reporting to the project governance group, the scoping project was auspiced under the following authorising frameworks. The Optimal Care Pathways, which are the national guides to optimal cancer care, acknowledges that even though the pathway for patients undergoing diagnosis and treatment for cancer is complex, health services should deliver optimal care that is culturally safe, responsive, irrespective of cultural heritage. The national standards require health services to address 6 actions that are specific to Aboriginal people, which I won't go into detail. But the key topic items addressed in the framework are clinical governance, partnering with consumers, and comprehensive care. And finally, the Victorian Cancer Plan provides a framework to improve cancer outcomes for all Victorians, with a focus on addressing needs for Aboriginal people affected by cancer. With the collaborative goals of the broader initiative in mind, WICMIX first posed the question, how do we create an environment where the Aboriginal and Torres Strait Islander person is not treated not only well and in a culturally respectful manner, but empowered to actively participate in interactions, being valued, understood, and supported? So we asked the question, what is cultural safety? There are 2 definitions on cultural safety. The first one, by Bacho, defines it as providing quality healthcare that fits within the familiar cultural values and norms of the person accessing the service that may differ from your own and/or dominant culture. And the other one is from the Corin Valid Jack strategic plan by the DHHS, saying that Aboriginal people feel safe where there's no challenge or need for the denial of their identity and where their needs are met. So how do we embark on the journey to understand what is cultural safety? How did we even begin with the gap analysis on such a subjective matter? The project adopted a mixed method approach to understand current practices and barriers. For the quantitative audit, we designed a self-assessment gap analysis tool based on the Western New South Wales PHN's cultural safety framework. The tool identified opportunities for improvement. For the qualitative audit, the interview questions were based on the study entitled Cancer Services and Their Initiatives to Improve the Care of Aboriginal and Torres Strait Islander Australians. In order to avoid any duplication of work and to encourage collaboration with other stakeholders in the same space, we consulted with Aboriginal health liaison officers from a metro and a regional health service and 3 different primary health care providers. We engaged and consulted widely, harnessing lessons learned and valuable expertise to inform this project. These stakeholders provided further context and rich insights around Aboriginal workforce models and care coordination for the local Aboriginal population. The results from the quantitative data analysis indicated that the partner sites currently have a number of initiatives in place towards ensuring cultural safe health service. However, the results also showed there's opportunity for further improvement individually and collectively as a precinct. Through the mixed method approach, we identified common strengths and 2 clear and consistent opportunities emerged across the partner sites. The first, improving Aboriginal and Torres Strait Islander patient identification on admission to the hospital, and improving cultural safety and healthcare with healthcare providers. The results also showed us that each of the health partners are at different stages of their journey in providing culturally appropriate healthcare. In order to inform appropriate yet evidence-based recommendations, it was pivotal to have a clear understanding on the principle of self-determination. What is self-determination? It is identified as the ability of Aboriginal people to determine their own political, economic, social and cultural development as an essential approach to overcoming Aboriginal and Torres Strait Islander disadvantage. As such, the recommendations that follow are evidence-based, as informed by literature, and do not replace the absolute requirement to co-design solutions with the local Aboriginal people. Sorry, I'm missing that. Based on the results of the gap analysis, there are several initiatives and actions that the Parkville Precinct partners can consider to undertake in short term, building a solid foundation for longer term initiatives. The short term initiatives can be summarised as the low-hanging fruits that each health service can focus establishing individually. The long-term initiatives place more emphasis on a collaborative workforce effort once the foundation of the short-term initiatives are established. In order to continue on this journey towards providing culturally safe and appropriate cancer care, these are the enablers for success. This is where commitments are critical from all fronts. Engagement from executives to lead and commit in closing the gap with a whole organisation approach, together with Aboriginal health agencies and local Aboriginal communities, is important. As for time, we need to be mindful that there is need for time to create greater things. It requires time and persistence to build success step by step, creating a solid foundation for cultural safety, sustainability and impact. Cultural sensitivity is a challenge. It isn't easy to adapt one's communication and behaviours to be compatible with another cultural form. If you haven't heard anything else from today, these are the 4 key takeaway messages from the project. Get the right people to join the table right from the start. Executive commitment is vital as it involves whole of organisation approach. We need to understand that culture influences individual experiences, viewpoints and thought processes, and this impacts on how we relate to others in keeping in mind the principle of self-determination. I find it both useful and challenging to think out of the box, to adapt and adjust the processes or methods to deliver value to all stakeholders. Thank you.
And we have barely time for one question. I think we need the microphone again.
Thank you very much. I just wonder, is your report available publicly if we were interested in reading more about them?
It will be. If you access my... can I bring it up on here? If you access our website, it will be there.
Brilliant. Thank you.
Thank you.
Thank you.